Well, you know, it wasn't, I can tell you this was not anything I ever set out to do. I never crossed my mind in a million years to be mayor, to be elected. You know, I think it was just really a series of being involved. I'm, you know, a pharmacist. I've worked at Raleigh Community Hospital, what is it, Duke Raleigh Hospital now, and had kids. They went to school. I started getting involved in PTA and very quickly realized that the decisions that were being made at the county level had a direct influence on the quality of education that my children were getting. So that's how I started engaging or harassing the county commissioners. I also then, you know, sort of through that process started working on people's campaigns. And I think it was just, you know, it's one of those things, the more you do, the more you find out that needs to be done. So, you know, the next thing I knew, I was on the Wake County PTA board as a vice president. And then I started the business in 2002, continued to be very involved in campaigns, just trying to get people elected and working on issues. I was the Homeowners Association president for 4 years. Oh my God. That's worse than being mayor. And then, you know, I had a few, you know how it is. Whenever you work on campaigns and you're involved and people start, oh, you should run. And I was like, no. For me, it was all about priorities. I had 3 kids. I didn't want to be at meetings all night. I wanted to be with them. So I figured I could spend time helping other people get elected to office. And then in 2009, my youngest was a senior in high school. The business had gotten big enough that I had managers, and they were great managers. And so I decided to run for city council and won. And did the city council thing for 2 terms, so that was 4 years. And it really dovetailed nicely. I mean, every time I decided to run, I would go back and sit down with everybody at the business and the managers and talk through it and talk about, you know, I'm going to be here this much less. And then by the time I decided to run for mayor, they were like, we don't need you. I will tell you, when my son, who was, I guess he was 21 at the time, I told him, I said, you know, I'm thinking about running for mayor. What do you think about that? And he said, why would you want to get blamed for everything? So that was a good response. My company is a specialty pharmacy. We are, think of pharmacy, then specialty, and then we are a niche within that. We do care in the home for certain chronic disease states that involve infusion medication, usually involve a nurse to administer that medicine. So we do hemophilia, and we do a lot of the neuromuscular peripheral neuropathies, multiple sclerosis, myasthenia gravis. So we do the drug, the nursing, the ancillaries, help you deal with your insurance, talk to your doctors, coordinate all that, go talk to your kid's school nurse if they have a school nurse. All of that to try and complete out that continuum of care. So from somebody that needs to be involved in public policy, wow, anybody involved in healthcare knows it kind of changes by the minute.